Hey, I'm Jonathan Gardner. I own Chiropractic Lifestyles in beautiful Columbia, South Carolina. Notice the sun. Just kidding. We just had a thunderstorm today. Anyway, we were wanting to talk a little bit about chiropractic today. My wife, Dr. Caitlin, and I are both chiropractors. We graduated from Life University in Marietta, Georgia. And there's a couple of things that I would like to tell people who are thinking about chiropractic care. I would think that most everyone has kind of seen some of it. You know, they could equate it to massage. They've likened it to physical therapy, like a doctor of physical therapy would use. We are mostly interested in kind of the nervous system, how the spine or disorders of the spine may affect that. Some people use a term joint manipulative therapy. The chiropractor generally calls it an adjustment. We don't always like to use the term manipulation. You know, opinions vary. But if you were to have a problem in your spine where you would have what we would call a subluxation, you know, two non-movable segments kind of coming to meet each other that aren't working to the best of their efficiency, might be putting some pressure on a nerve there or causing some other ligamentous dysfunction. Even, you know, if you're going to talk about some of the other ligaments that are inside of the spinal column, that could change, you know, the way that your nervous system can be affected at the entire opposite end of the spine. But that's a discussion for another time. What we'd rather, you know, dwell on here and now is why somebody would want to be a chiropractor, what questions you would have, maybe the 10 years that my wife and I are in practice, what we would want to do differently if we had to start all over again. Another thing that we'd like to discuss is, you know, what could chiropractic do in a functional medicine model? What could it do to help, you know, regular medicine? What could you perhaps start with? Let's say in the state of South Carolina, I'm not able to advise for or against drugs or surgery. That's not something that's in my scope of practice. But I can talk about hygienic issues such as, you know, B12 or something like that. We could talk about how if your body's deficient in vitamin D, you know, there might be some things that you could do to help vitamin D be absorbed better so that your internal organs can work better. Not that that's so structurally relevant to the spine, but it could help, let's say, as opposed to having to take a medicine. Not that I would tell you not to take a medicine. That would be up to your medical doctor to advise for. But if you could do some of those more functional medicine things, in addition to letting your spine work more like it should without having to use traditional drugs, hopefully not having to get all the way to where you have to do some type of surgery for, you know, postural abnormality, an issue like that. You know, those are all interesting things that I think would be fun to consider if you're thinking about a career that maybe could be helpful, could be fun, could be friendly, can be for all ages. You know, a typical day in our office, we'll see newborn babies all the way up to my oldest patient is 103 right now. Obviously, there's differing techniques. You're not going to be using a high velocity adjustment on a newborn baby by any means. That's not at all what we're trying to imply. Love to show you guys more videos of that later. It's a very simple and effective techniques. The same way it's a simple and effective technique to adjust a 103-year-old man. But on our day-to-day life, the advantages we'd like to see is if you can look and find what you can do to make money and you can help the community around you, kind of aligns with something that you may find valuable to your soul. You know, those are probably my wife and I's favorite parts of chiropractic. It is also fun to own your own place sometimes. You know, it's a little bit more work, but you can bring your kids to the office. You could homeschool if you wanted to. You could have a little bit more variety in what you do day to day. And that's any, you know, job that you own and have some freedom there. Not just chiropractic, but it seems like most chiropractors end up owning their own place as opposed to working for another doctor. And that's just a fun place to start. Some of the things we'd like to offer for you guys to think about today. Any other questions?
What's the most rewarding aspect of being a chiropractor?
I feel like we already talked about that a little bit. It's how those things kind of overlap, where you can have something that you can make money with. You can have something that is doing no harm. It's helping the community around you. And that, you know, that's the most rewarding thing for me. It's something that I love, I'm passionate about. And if chiropractic resounds with you, I'd be more than happy if you wanted to get in contact with me to talk about it.
What are some of the biggest challenges you face in practice?
It is tough to go home at the end of the day, and I believe this would be in any profession where you're dealing with people, and leave it there at the office. If you really love people, it's hard to say, well, I met this person and they had this thing and we want to help them with that, and maybe they're not getting the results they want. You got to come home and you kind of think about your failures a little bit. That's what's hard for me, specifically with the type of person that I am, but um, that's one of the things.
What advice would you give to someone interested in pursuing a chiropractic career?
I don't know that the college that you go to, there's several around the United States, matters as much as maybe some of the other seminars that you do. I think interning with the doctor, like I said, if you'd like to talk with me, you don't even have to work with the doctor in person, before you go to school, but just spending some time hanging out with some people to make sure that's really what you want to do, because it is a big chunk to bite off for student loan debt. It's something that you should be cautious about, make wise decisions. I would want to tell my younger self or anybody else that you should spend a little time with a couple of doctors, know what it is that you're passionate about, and then kind of go from there.
How would you describe chiropractic care to a kid?
Well, that's kind of tough. We make, a couple little jokes. We talk about like popcorn in your spine. It depends on what age child that you're talking about. The easiest thing for a child is I'd usually show them one of the models in our office and say, how the whole body works. And they're like, yeah, brain. Most every 3-year-old will say something about their brain. And you're like, yeah, that's a good idea. You send some signals from the brain down to the rest of your body. Your spinal cord is the one housing most of the protection around your spinal cord is done by the bones, and they need to still be mobile so you can move around. That's a little bit farther than you would do for a 3-year-old. But you just say, hey, your brain likes to send all these signals to your body, and if you got something what's crooked, that's just a joke in South Carolina. Instead of that's crooked, you say what's crooked. It'd be nice to let it move like it should so it wouldn't put as much pressure on a nerve. But I'd have to have a kid in front of me to be able to communicate with them and show you how I'd really answer that.
Anything else you'd like to add about chiropractic?
I could talk all day, but I don't know what else to say.
There's a lot of love in chiropractic care.
That's true. It's very fulfilling.